The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history and physical is the starting point of a patient's story. This is a time when our physician-patient relationship begins. The patient will explain their past medical history and mention their medications. I will then perform a thorough physical exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me, I listen to what they're saying, and I feel them both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. If you wait, it's too late. To my military family, I got your six. To my Masonic brothers, the light is bright. Before I discuss today's topic, I'd like to share a most recent experience. My wife and I, we're at the point, the stage in our life that we decided every 4 months we're going to go away on vacation, just to recharge our batteries. I'm 58, and it's just, I only have so much energy, so many hours of the day, and I can only go so, push hard for so long, and I used, fatigue and burnout, mental burnout. And I said, no more. It's time for me to start taking time off. So we every 4 months we take a vacation, whether it's a full week, 2-week vacation, or it's just a mini 4-day vacation, like a power nap, like a power vacation, just to get away, just to relax and decompress. 2 Sundays ago, I don't really have much time to work on the house. And so I said, okay, I need to work on the house, have my chores. I have to work on my koi pond. I need to clean the garage out, power wash the house, the driveway and so forth. So I started at 9 o'clock in the morning. I worked to 5:30 p.m. And being a dummy, my wife reminded me I did not wear a hat. So what happened? I got a sunburn. And it was a goodie, I felt hot. So that was Sunday night. I was up every hour putting tons of aloe on. I need to get this burn under control. Well, every hour drinking and going to the bathroom, I didn't sleep. Just a few hours sleep. And for me, I need about 8 to 10 hours worth of sleep just to recharge my batteries. That's just my genetics. Other people can function on 4 to 6 hours. For me, I need 8. Well, that was Monday. Tuesday. So going from Sunday to Monday. Now, Monday, I work a long day. I'm doing 12-hour shift. I work. I come home. I go to the gym. I'm pushing hard. Still have the burn. Not able to sleep much. Only slept a couple hours again. That's 2 days in a row. Now, I'm trying to, Tuesday night, we taped last week's show because I had to get it in because I was leaving for vacation. So I had to tape earlier than I usually do. So I didn't get home until 11:30 Tuesday evening. The burn feels good. The aloe worked. I felt great. Drinking plenty of water. Well, I have to get up 4 o'clock in the morning so we can catch an early flight. That's 3 days in a row. I averaged about 3 to 4 hours worth of sleep. Now, I, again, need 8 to 10 hours sleep. So we finally reached my destination Wednesday evening, and all of a sudden, I feel fatigued. I'm getting the fevers and chills. I'm like, I can't believe this. I am developing the flu. So that was Wednesday. I slept Thursday, Friday, and Saturday. Some vacation, right? So I slept. Finally, I felt better. I was able to go to the pool on Saturday during the day and just hung out. You know, of course, I had a hat on. My wife reminded me, wear a hat and put sunblock on. And then we went out to dinner, and now it's Sunday. I hung out at the pool. We caught a plane back home. Sunday night, on the way home, I started to develop a left ear ache. Turns out I developed a swimmer's ear. I said, are you kidding me? I said, I was only in the pool twice. I started off my vacation with flu-like symptoms, which turns into the flu. And I ended my vacation with an otitis externa, what we call swimmer's ear. So I'm still suffering from now. I'm putting in ear drops because the outer portion of my ear swelled up. I'm like, are you kidding me? This is the nightmare from, not Elm Street, but this is the nightmare from North Ocean Drive. It's one thing after another. It was just not meant to be. So anyway, that's a nice segue that's going to lead in today's topic, which is going to be the flu. We're seeing a spike in the flu on Long Island. The past 2 weeks, we're seeing a lot of school teachers come in. Students are testing positive for the flu, and they come in, they get tested, and they're testing positive for the flu as well. So today, what I'd like to do is let's define what the flu is, and then we're going to compare it to COVID-19. So what is the flu? The flu is really called influenza, and it's commonly known as the flu. This is a viral infection that attacks our respiratory system, which includes your nose, throat, and lungs. For most people, the flu resolves on its own, meaning it's self-limiting. It's just gonna, once the clock strikes 12, the virus dies, your body flushes it out, and within a few days, you're back to normal. But there are some times where there's complications which can lead to death. According to the CDC, an average of 36,000 people died of the flu over the past 10 years. Okay, so the past decade, the past 10 years, about 36,000 people. So very important to understand what the flu is. The flu is not COVID, and COVID is not the flu. There's a lot of similarities, but they're not the same. Two different virus families. All right. Who are at risk for developing flu complications? Young children under the age of 5, especially those under 6 months old. Adults older than 65, that's why we recommend 65 and older have the flu shot. Now, when do we have what we call flu season? Flu season starts late August, September, straight through to December, January, February, because we extended to February. But I was taught to like January. Now we extended to February. Residents of nursing homes and other long-term care facilities, pregnant women to up to 2 weeks after giving birth. People with the weakened immune systems, those that are who are immunocompromised patients that suffer from HIV or any other medical condition that really depletes the immune system. Someone who has cancer and they're taking medication that basically wipes out the immune system. These individuals are at much higher risk for contracting the flu. Native Americans, people who have chronic illness such as asthma, heart disease, kidney disease, liver disease, and diabetes. This is something important right here. The next one. People who are very obese. Well, very obese. Obese and obese. Okay, what's very obese? Let's clean that up a little bit. So you have obesity. What did I say? Again, go back to my show where I defined obesity. Obesity is 20% over ideal body weight. Then you have morbid obesity, which is 100%. So we're talking individuals who are morbid obese have a high risk for developing flu. All right. That's something that's common with the COVID-19. All right. So we're going to wrap up the first half of the show. If you're looking for a physician, you're unhappy with your current relationship, you just need a new physician. I offer a very affordable concierge practice for the price of less than a monthly cell phone bill. You can come in and you can be seen and cared by Dr. Tommy O. I offer a very affordable practice. You have access to top-notch care, someone who's going to look, listen, and feel. So to learn more about my practice, go to drtommyo.com. That's drtommyo.com, or give us a call at 631-980-8200. 631-980-8200. Welcome back to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. I offer a very affordable concierge practice for the cost of less than a cell phone monthly bill. You have access to the care you need and deserve. To learn more about my practice, go to drtommyo.com. That's drtommyo.com, or give us a call at 631-980-8200. 631-980-8200. Today's topic: influenza. I started the show off going over, the story that I just had. Like I said, the nightmare from North Ocean Drive. The flu. Yeah, it's the flu. Yes, it's very common. It was like one of those medical conditions that was overlooked and forgot about because of COVID-19. It's been around forever. Okay, it's like it didn't exist. It's been around. It's very common. A lot of deaths each year. Like I said, over the past decade, 36,000. So yeah, it's approximately 3,600 if you wanted to, split it. Let's say 3,600 deaths each year annually. Again, that's just a based on the past decade of 36,000. If we divide it by 10, some years they could be a little bit more, some years a little bit different. So I discussed the high risks. Again, I mentioned weight. Weight is so important. People don't realize that your body mass index, the higher that number is, when you start getting into obesity and morbid obesity, obesity is 20% over ideal body weight. Morbid obesity is 100% over ideal body weight. But when you increase that number, that increases the risk for other medical conditions. If you have a condition that can lead to complications. Okay, and that's what we're discussing here, complications. So what are common signs and symptoms of the flu? Fever, aches and pains, that joint pain, muscle tightness and cramping, the chills and the sweats. I call it your core body temperature starts to drop out and you start to shiver. Your muscles start to contract really fast to increase that body temperature. You take a warm shower, you feel great. You got to get your body temperature up. You step right out of the shower and your core body temperature drops right down. That's what we're talking about. Headaches, dry, persistent cough, shortness of breath, tiredness and weakness, runny or stuffy nose, sore throat, and eye pain. Most of these symptoms I was experiencing, the fevers and chills. My core temperature started to drop a little bit. I was lucky, I was able to control that immediately. For me, I did not self-medicate. What I did was I drank a lot of fluid, kept my extra blanket on the bed, and you need to sweat it out, get my core temperature up real high, and I wanted to break it. That's just how I handle it. There's all different ways to handle, depending on the comorbid the condition or symptoms that associate with it. Now, if you have increased risks, you take a more aggressive approach. If you have diabetes, you have hypertension, you have morbid obesity, you're going to be a little bit more aggressive. With me, again, I don't have those conditions, so I took more of a conservative approach. Now, signs and symptoms of the both could be very, 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 very simple, from mild to severe. Again, for those severe conditions, what do? You seek help with your, medical doctor. You come and you give us a call. So we can decide what's the best approach for you. For me, I took a very conservative approach. Hot steamy shower, plenty of fluids. I wanted to rehydrate. Make sure fluid hydration is important. I drank more than just water. I had like an electrolyte replacement, and then I just slept it out. I needed to. I lost a lot of sleep over the previous days. I had to make up for that lost sleep and allow my immune system to rebuild itself to gain strength again. All right, so. Let's learn about my practice. Okay, I offer a very affordable concierge practice of less than a cell phone monthly bill. This gives me this gives you the access to affordable care, the care that you deserve. To learn more about my practice, go to drtommyoat.com. That's drtommyoat.com, or give me a call at 631-980-8200. All right, so let's go on to COVID-19. All right. Is the COVID-19 a flu? No, it's not. COVID-19 is caused by a different family of viruses called the SARS-CoV-2 virus, while influenza is caused by influenza A and B viruses. Again, a different family. On the surface, meaning not the virus itself, I'm talking about when you show signs and symptoms, a lot of the signs and symptoms are very similar, but there are differences. And that's what a physician is trained to recognize. Both COVID-19 and the flu spread in very similar ways. They can both be spread between people who are in close contact. The virus is spread through respiratory droplets or aerosols released in the air, such as sneezing and coughing. It's like you're walking through a sneeze or a cough cloud, and you inhale, and then those little the respiratory pellets, you inhale them and they attach into the nasal passages, and then they start to multiply. Like I said, these droplets, they land in your mouth or your nose or somewhere nearby, and you inhale them, or someone coughs. And then the respiratory pellets spread on a countertop. That's why you got to cover your mouth when you cough, okay? Well, now it's on a countertop or even a keyboard, right? Your keyboard, you place your hands on the keyboard, you start typing away. Next, you reach to your nose and your mouth, and there you go. We just self-inoculated with the respiratory pellets. You got to be really, really careful. How do we prevent this? Let's be smart, okay? You're not going to prevent it. What we're going to do is let's reduce the risk for spreading and contracting, okay? And that's what this is about. And that's what they didn't focus on the past 2 years. They're talking about, pushing certain agenda. No, what we want to do is the virus is here. It's been around for a long time. This is nothing new. These viruses, the SARS virus has been around a long time. The coronavirus, okay, COVID is new, but it's just a modification, mutation of a virus that's been around a long time. Flu's been around a long time. So we're not going to change that, but we have to change our behavior and how we address it, okay? We want to be smart, okay? Being smart is proper hygiene, okay? Cover your mouth when you cough. Wash your hands. Keep your hands away from your mouth, okay? You don't want to introduce any of viruses, bacteria, or fungus into your face and nose. That's how we get sick, all right? Just be smart about things. Don't take risky behavior, right? Didn't I say that? We always discuss about risky behavior. Just 2 weekends ago on Sunday, risky behavior. I was out in the sun for 9 hours and I didn't wear a hat. And what did I got a sunburn, all right, okay, and I paid for it the following day. I didn't sleep, and I had to just put tons of aloe on my head to control that. All right, so both are common. You see fevers, coughs, shortness of breath, difficulty with breathing, tiredness, sore throat, runny nose, stuffy nose, muscle aches, headaches, nausea, vomiting, and something which is a little bit different with the COVID. You have that loss of taste, and you can have pain below the knee and above the ankle. And they discovered that is microclots. You don't have that with the flu. All right, so getting ready to wrap down this show. So today's show was about influenza, or what we call the flu. You need to be smart. Hygiene, keep your hands away from your face, clean your hands. Just be smart, okay? You want to protect each other. If you're going to cough, cough into your hand and wash your hands off. You don't want to spread germs. All right, so to learn more about my practice, go to drtommyo.com. That's drtommyo.com. Or you can come by my office and visit. That's 250 Patchogue Yaphank Road, Suite 16. That's East Patchogue, New York, 11726. Give us a call, 631-980-8200, 631-980-8200. I am accepting patients, a concierge practice. See you then. Thanks. Bye-bye.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.